like the double mushroom and Swiss burger. The General Store on 24 in Lewis.
Now we want to welcome in studio.
Yes, welcome.
Natalie with the Delaware Public Health, Diabetes, and Health Disease Prevention Control for the state of Delaware.
Yes.
Good morning.
Yeah, thank you.
Welcome.
Thank you
You're a
so
very
much
important
for having
person.
me.
Yes, absolutely. Absolutely. So, you say you've heard of Matt Rife. You know they're the hottest thing it's going right now.
Exactly.
All right, so you're here today to talk about some programs that the state of Delaware is offering as far as high blood pressure goes and heart disease. And I want to say that, this kind of hits close home to me because I and my family has a history of high blood pressure.
Hereditary is definitely a big thing for high blood pressure.
Yeah.
Definitely.
And he has it, and I deal with it
Okay.
for many, many years.
Right.
Okay.
Well, talk to us a little bit about high blood pressure and, the state of Delaware, how many Delawareans, roughly, or is it a huge number of people who deal with this every day?
Actually, it is. It's 1 in 3 Delawareans
Wow.
have high blood pressure.
Wow.
That's 288,000 of us.
Wow.
And a lot of times, like 48% of us do not have it under control out of that 1 in 3. And
Well,
then-
that's on half. That's almost half.
Yeah, and 36% out of that don't even know they have
They
it.
have it.
Wow.
Okay.
So what's a good blood pressure look like? I mean, I know, but the numbers have changed over the years, I believe.
They have a little bit.
Yeah.
Yes.
So if
So,
you go to the doctor, get your blood pressure, or maybe even you go into Walmart and get it checked or whatever.
Absolutely.
What's a good blood pressure look like?
You're looking for a top number of 120 and a bottom number of 80 is what you're looking
Okay,
for.
120 over 80.
And I know my
Correct.
doctor even likes it a little bit lower.
A little bit lower, not too low, but
Right.
a little bit lower is definitely, gives you a little room to wiggle.
Yeah. Okay. So how often should people be checking their blood pressure if they don't know? How often should the normal person listening right now be, checking that?
We suggest 2 times at least a month.
Okay.
Oh.
But of course, you're always going to follow what your doctor is going to say. So we actually tell people, at the beginning of our program, we like to tell people to do it once as soon as they get up without any medication after they go to the restroom. And then later in the day after they've taken their medication and went around,
Right.
did what they normally do.
Are there symptoms that people get, if
what do
they
they feel?
have high blood pressure and they don't know it? If they haven't been checking it regularly, what are some symptoms possibly if they could have high blood pressure?
Well, it's actually known as the silent killer. There are no symptoms. That's why a lot of people just
Don't
don't
even know
even
they
know
have
they
it.
have it. Yes.
Wow.
So,
That's scary.
Yeah, and it can cause tons of other, health problems like heart disease, heart attacks, strokes, you name it, it does it. Kidney, failure, and it just goes on and on.
What are some things that people should avoid if they have high blood pressure?
Well, there's a few things that they can do. First, they can start off by eating a better diet.
Right.
So a lot of fruits and vegetables, whole grains, lean meats. They can exercise. We're only talking about doing 30 minutes per day.
Yeah.
And it's just walking. You don't have to do any,
Right.
there's nothing,
Weights and anything
You
extensive.
do not have to, although throwing in weights is a good thing.
Right.
But it's just that making sure that you're being compliant with your medications. So if your doctor's prescribed, just take it exactly how they
How they say
prescribe.
it.
Yep.
Okay. Very good. Now you guys offer some free programs, a free program. And this is, I didn't even know about this. Yeah. Talk to us about
This is
it.
neat.
Well, this is the Healthy Heart Ambassador blood pressure self-monitoring program.
Okay.
And it is a free program to Delawareans that are above the age of 18. And although they cannot have any cardiac event within the last 12 months, they can't be at risk or have lymphedema, which is a swelling of arms and legs, and or let's see, one more thing. I always forget that thing. All right. Well, we'll get back to it.
Yeah. It's all good.
Yeah,
But they have to be at least 18 for the program?
at least
Okay.
18. Yes.
Okay. So also not just high blood pressure, but also heart disease as well.
Exactly.
Yeah, yeah. What are some symptoms of heart disease?
Now,
and
heart
signs?
disease, again, it's when your valves actually start to harden.
Okay.
And it restricts the blood flow to your heart, brain,
Okay.
or any of your vital organs. And what it causes it to die, basically. And so you will have like angina, heart attacks, strokes, that kind of thing.
That's another thing that kind of hits close to home for me because my grandmom had the coronary artery.
Exactly. Ugh,
Yeah.
yeah, it's terrible.
Wow. Is it different between men and women as far as blood pressure and or heart disease?
It really isn't.
Okay.
They go about the same rate, or they end up. Men get it a little bit sooner than women, but women catch up to men with no problem.
Wow. Now, if someone is listening and they haven't gotten their blood pressure checked, they quite frankly don't even go to the doctor. I know there's a lot of people who do listen who don't. They haven't been to the doctor in years. I feel fine. I'm good. But really you should get checked. Where can
Absolutely.
someone, get started? Where can someone go get their blood pressure checked, go get checked out? What can they do?
Well, they can go to like any drugstore, Walmart, Targets, that kind of thing.
So you don't even have to call and
You
set up
don't
an
even have-
appointment.
nope.
You can go to Walmart.
Yeah,
That's
you
easy.
Definitely go. Yeah.
Yes, so convenient.
Absolutely. But the blood pressure monitors themselves are not very expensive, and you can have one at home and check it, and you'll notice something going on a lot faster.
I see here that on my cheat sheet here that you have on here some tips that make it easier for you to talk to your doctor. I know sometimes people get a little bit overwhelmed and
Yes.
they don't
Or
they're embarrassed.
Yeah.
Which, by the way, like back in the day, I used to be like, I don't want to tell nobody I got any problems. I'm good to go.
Yeah.
But now I'm 41. Look, that's all out the window.
Yeah.
I don't even
course.
want to tell you what I've told my doctor.
Well, you've got to trust your doctor
Yes.
and be brutally honest with your doctor.
You
Yes.
really do.
They've heard
Yeah.
it all. They
Oh,
don't
they-
care.
They have
really
heard it
have.
all. They have
All.
checked everyone's crevices. They know everything about what's going
Everything.
on.
So the more honest you are with your doctor, the better.
That's so true.
Yeah.
Absolutely.
So, tons of different things. What if a lot of people, they want to exercise, they want to get on this program, but it's just so hard and they don't want to stop, eating certain foods. They don't want to stop drinking alcohol. Is there like a balance? Is there some kind of...
There is.
Okay.
Absolutely. So we just try to cut down on your salt, processed foods, and, convenience foods like lunch meat, that kind of thing. Those things are loaded with salt and preservatives. So we want you to eat more fresh fruit, lean meats, whole grains. And you can definitely get a monitor. And then we, in the HHA program, will actually give you a free blood pressure monitor. It's an Omron
okay.
5 series. And we give out nutrition courses and education courses.
Oh, nice.
So, and it's all free.
Okay, very
All
good. If
free.
people want to get involved in that and they want to see if they qualify and, take advantage of this free program, how can they do that?
Well, you can visit healthydelaware.org or give us a call at 302-208-9097.
Very good. Anything else you want to add
awesome.
before we wrap up?
Please call. It is free.
Yes.
Yeah.
Very important.
Yeah.
It's
Free.
free. Again, healthydelaware.org, 302-208-9097. And of course, they got an email as well, DHSS_DPH_HHA at Delaware.gov. You can enroll. You can get more information there as well. And then I also see classes held virtually and in person.
Yes, and
So,
we even
very
have on
convenient.
demand if you can't make any of those. So
Nice.
we really just want you to have the
And
information.
be healthy. Yeah,
Yes.
great.
Natalie from the Delaware Public Health, Diabetes, and Health Disease and Prevention Control. Did I get that all right?
Yes, you did.
Yes. Thank you so much for coming in today. We
Thank
appreciate
you so
it.
much.
All right.
Very
bye-bye.
good. 7:56. We do have the coffee mix coming up and the Bill